Hello, everyone. I'm Professor Xiaojun Huang from Peking University People's Hospital and Peking University Institute of Hematology. Today, I'm honored to share with you the topic 50 years of hematopoietic stem cell transplantation. My presentation will cover four areas: the global development of HSCT, the progress and practice in China, advances in novel cellular immunotherapy, and future directions in precision cellular therapy. In 1939, the first attempt at bone marrow transplantation in humans was made. A physician transfused bone marrow from an ABO-compatible sibling into a patient with aplastic anemia caused by heavy metal exposure. Although the procedure was unsuccessful, it marked the beginning of the era of transplantation medicine. In 1957, Dr. Edward Donald Thomas pioneered modern hematopoietic stem cell transplantation, HSCT. Among the first 6 patients he treated, only one survived beyond 100 days. By 1977, he had completed 100 HLA-matched sibling transplants, with 13 patients achieving long-term survival. In 1979, he applied the same approach to patients with acute leukemia in remission, increasing the 2-year survival rate from less than 15% to 50%. In 1980, he performed the first unrelated HLA-matched bone marrow transplantation, addressing the problem of donor scarcity. These 3 breakthroughs laid the foundation for his recognition as the father of hematopoietic stem cell transplantation. In the same year, 1977, autologous transplantation was successfully applied for the first time in a patient with relapsed acute myeloid leukemia, AML, and later extended to the treatment of lymphoma and multiple myeloma. Subsequently, haploidentical hematopoietic stem cell transplantation gradually evolved. The Italian protocol, which involved ex vivo T-cell depletion and infusion of high-dose CD34 plus cells, reported in 1998 a 1.5-year DFS rate of 36% plus or minus 11% for AML. The presence of donor NK cell alloreactivity in this protocol helped reduce relapse in AML patients. In 2000, we established the Beijing Protocol, which induces immune tolerance using GCSF and ATG without the need for T-cell depletion, and integrates both bone marrow and peripheral blood transplantation. In 2008, Johns Hopkins University introduced the Baltimore Protocol based on PTCY, which significantly improved GVHD control and transplant outcomes. In 2016, the Beijing Protocol accelerated the global expansion of hematopoietic stem cell transplantation. Today, more than 35,000 transplant procedures are performed worldwide each year. In 1964, China made a landmark breakthrough in the field of hematopoietic stem cell transplantation. That year, academician Dao Peilu successfully performed Asia's first and the world's 4th allogeneic syngeneic bone marrow transplant at Peking University People's Hospital, giving a new lease on life to a patient with aplastic anemia. This marked the beginning of our nation's journey in this field. In 1981, academician Liu achieved China's first HLA-matched sibling allo-HSCT and published the results in 1984, laying a solid foundation for the advancement of related technologies. In 1986, Professor Wen Weiyan STEAM accomplished the country's first autologous bone marrow transplant, which was formally published in 1998, filling a critical gap in our therapeutic arsenal. Entering the 21st century, I personally witnessed and contributed to China's HSCT entering a phase of rapid development. In 2000, our team took the lead in achieving HLA haploidentical transplantation through cytokine-induced immune tolerance in sibling donors. In 2002, we successfully completed the first haploidentical transplantation using a parent donor. These innovations not only expanded clinical strategies but also laid the groundwork for what would later become known as the Beijing Protocol. In 2011, with support from a national key research program. We were the first to demonstrate that haploidentical transplantation was more effective than conventional chemotherapy in treating adult standard-risk acute lymphoblastic leukemia. This evidence bolstered our confidence in further promoting the Beijing Protocol. I have always believed that a donor for everyone should not remain a slogan, but become a reality. The establishment of the Beijing Protocol has realized this goal. Today, it stands as the most widely used haploidentical transplantation system in the world, heralding a new era in hematopoietic stem cell transplantation. In 2016, the president of the World Marrow Donor Association officially named our team's non-T-cell depleted haploidentical transplantation system the Beijing Protocol, a profound recognition of our years of perseverance and innovation. This breakthrough not only overcame the immune barriers caused by HLA mismatching and resolved issues of graft rejection, but also expanded indications to benign hematological diseases such as severe aplastic anemia, hereditary spherocytosis, and genetic metabolic disorders, thereby advancing the universality of transplantation technologies. Thanks to the persistent efforts of my team and I, the haploidentical transplantation technique has been rapidly adopted nationwide. By 2022, 94% of all haploidentical transplants in China employed the Beijing Protocol. The number of transplant centers in China grew from 27 in 2008 to 194 in 2022, reflecting remarkable growth. At Peking University People's Hospital, the birthplace of the Beijing Protocol, we completed over 1,300 hematopoietic stem cell transplants by 2022, including more than 900 haploidentical cases. Our center has thus become the largest haplo-SCT center in the world. I fully understand that achievements are built not only on technological accumulation but also on relentless innovation and rigorous practice. The Beijing Protocol is a prime example of how original Chinese technology is reshaping the global landscape. Its influence has already crossed borders and has been included in several leading international textbooks. For instance, Blood noted that the Beijing Protocol accounts for nearly half of all haplo-HSCTs globally. The fifth edition of Thomas' Hematopoietic Cell Transplantation observed that both Korea and Italy have adapted their protocols based on our technique with great success. Jeff Schur, current president of the World Marrow Donor Association, and his predecessor Yoshihisa Kodera have both highly praised the Beijing Protocol as a reliable alternative for patients without matched donors. As one of the main advocates of the Beijing Protocol, I have always upheld a patient-centered philosophy and instilled a culture of seeking clinical answers through scientific research within our team. Moving forward, we will continue exploring new frontiers in perfecting the haploidentical transplant system, using Chinese wisdom and original innovations to open doors to new life for patients with blood diseases around the world. In recent years, CAR-T therapy has drawn significant attention for its rapid advancements. In 2011, pioneers in the CAR-T field, Professors Carl H. June, Stephen A. Rosenberg, and Michel Sadelain successfully treated a child with severe BALL using CAR-T cells, marking the beginning of a new era in clinical cellular immunotherapy. In 2014, Professor Wei Donghan, team in China, published results in clinical cancer research, demonstrating the use of EGFR-targeted CAR-T technology to treat biliary system tumors. This was the first attempt at applying CAR-T therapy to solid tumors in China. Since then, the country has made continuous strides in the field, achieving breakthroughs in multiple targets, cell constructs, and therapeutic approaches. Several CAR-T products have already been approved for market, offering new hope to patients with hematologic malignancies. In terms of clinical research, Chinese scholars have actively explored CAR-T therapies and achieved remarkable results. For instance, Staro-X40 T cells have been used to treat relapsed refractory BALL CD38 CAR-T therapy. has shown promise in relapsed refractory AML. NS7CAR, a naturally selected CD7 CAR-T, has demonstrated efficacy in treating difficult-to-treat TALL. And RD1301, a universal CD7 CAR-T, has also achieved encouraging outcomes. In 2024, Professor He Huang's team proposed an integrated treatment strategy that combines CAR T-cell therapy with sequential allo-HSCT. This model leverages the tumor-clearing capacity of CAR T-cells alongside the durable anti-leukemic effects of allogeneic stem cell transplantation. It is particularly suited for CD7-positive refractory patients who do not meet the criteria for conventional transplantation, providing a novel clinical option. Although China still faces gaps in regulatory frameworks and conceptual alignment compared to the United States, we have entered a stage of independent and comprehensive development. Many key technologies and treatment strategies are now being developed domestically without reliance on external models. In my view, China's ongoing efforts in CAR T-cell therapy have not only enriched the therapeutic landscape but also contributed vital Chinese wisdom to the global advancement of this field. Standing at the forefront of rapidly advancing technologies, I am increasingly convinced that precision cellular therapy will become the core direction for the future treatment of hematologic malignancies. In the realm of precision HSCT, my team and I have continuously explored how to optimize conditioning regimens with particular attention to the special needs of elderly patients and those with underlying conditions. In 2021, we conducted a prospective clinical study involving 50 patients aged 55 or older with acute leukemia or myelodysplastic syndromes. We applied a novel reduced-intensity conditioning regimen combining low-dose cyclophosphamide, fludarabine, antithymocyte, globulin, and bisulfan. The results showed a treatment-related mortality rate of only 23.3% within the first year, a cumulative incidence of relapse of 16.5%, an overall survival rate of 63.5%, and a leukemia-free survival rate of 60.2% at 1 year. These outcomes were comparable to those of traditional BUCI ATG protocols, fully demonstrating the feasibility and safety of this approach in elderly haploidentical transplant recipients. In 2023, we further confirmed the effectiveness of post-transplant interferon alpha therapy in patients with MRD-positive AML following allo-HSCT. This strategy not only enhanced post-transplant anti-relapse efficacy, but also provided a new direction for future MRD-targeted interventions. At the same time, CAR T-cell therapy, as a novel form of cellular immunotherapy, has shown tremendous potential. In a 2022 study, Professor Shi Zhang of the Second Affiliated Hospital of Army Medical University, Xinqiao Hospital, summarized the potential advantages of CAR T therapy with HSCT, offering a new perspective on integrating traditional curative approaches with cutting-edge cellular immunotherapies. Subsequent research further validated that early intervention with CAR T could effectively eradicate post-transplant MRD, strengthening the clinical value of a combined transplant plus immunotherapy strategy. Today, the deep integration of novel cellular immunotherapies and precision HSCT is guiding hematologic malignancy patients toward a new era of long-term disease-free survival. Looking ahead, as technologies continue to evolve and clinical applications expand, this combined treatment model holds great promise in bringing renewed hope to more patients.